Hello, everyone. We are so excited that you are here. Only 3 minutes past the deadline, but we have live faces. I'm so excited.
Yay!
I've been praying all day. Please, no glitches, just no glitches. So thank you for taking time out of your day. My name is Kristen Richards. You guys know me from Instagram. I have lipedema. I've had surgery. I'm a huge proponent of GLP-1s, specifically tirzepatide. And I started asking Carla about this a couple weeks ago. And she, right before this call, she said, I love tirzepatide. I said, me too, sister. Me too. So we are going to dive in. I want to tell you just a little bit about Carla. Carla is an accomplished healthcare professional. She has specialized expertise with credentials in, and you'll have to help me here, AGNP, and it's adult.
That's adult geriatric acute care adult geriatric nurse practitioner, actually. Yes.
And American Association of Healthcare Professionals. So several different certifications. So we've got that.
Can I correct that one?
Please.
Because I know I told you that, but it's the American Academy of Anti-Aging Medicine.
Oh, hey,
Yes.
take that one
Yes.
even more.
Yes. And hormones is what they do best, and peptides. They do all the chemicals best. They call it the hormonal symphony, and it's all tied together.
I love it. I love it. Well, we are so grateful you are here. Carla not only is a breast cancer survivor, an NP that's only and specifically working with lipedema women, but she's also she has lipedema. So, I mean, all of the hats that we're wearing and navigating. Of course, I'm not an NP. I just pretend to have a little bit of information and share all of her information. But again, we're so grateful that you are here. What I'd like to do, Carla, is just start us off with a couple myths. We're going to bust some
Sure.
myths up in here. And then I'm going to turn it over to Carla, and she's got some information she's going to run through with us. And then we'll wrap it up. So, Carla, the first myth that I would like to bust with you and get your feedback, get your
Okay.
opinion is if I start a GLP-1, I'm going to have to be on it forever.
No, that's not necessarily true. Sometimes we have to have something, do a little bit something to shake things up. And there's more and more evidence actually about fibrosis, and lipedema actually is fibrosis. So inflammation, actually, wherever inflammation comes from, it sets off a pathway. And the pathway, I'm trying to make it easy peasy. Inflammation can actually come from mental or emotional stress, and it ends up setting off the HPA axis, cortisol. Cortisol makes the blood sugar rise, then we have insulin peaks, and it's all after that point, it is the inflammatory cascade. And it is all of the inflammatory cytokines, leukotrienes, thromboxanes. And I know those words I'm throwing a lot at you, but just know that wherever the inflammation comes from, it all ends up at the same place. We might have a virus, or we might have an infection. We might eat a lot of carbohydrates that set off that insulin peak and then that cascade, or we might have unbalanced hormones. And if our estrogen, if we're not using it and losing it, our estrogen metabolites actually cause inflammation, and they go on to that metabolite goes to the estrogen receptors, and that sets off the inflammation. And then there's these other things that happen that are growth factors that stimulate the fibrosis. So we're at that fibrosis, and then we've already done all of this, and we're into that lipedema that we know has a lot of inflammatory cytokines. And I will show you a diagram in a few minutes. However, I said all that to say this: it's proven that tirzepatide decreases inflammation.
Mhm.
Tirzepatide draws out this inflammation. And once we do gain a certain amount of weight, the fat cells themselves cause inflammation because the fat cells have estrogen. The estrogen produces aromatase. The aromatase produces more estrogen. So we are in this cycle, and we can't get out of it. So once we've gained a certain amount of weight, it might take something drastic, or this is not that drastic to me, it's just normal to get us out of that inflammatory cycle. And I do have some diagrams to explain exactly this. But once we get over that and get rid of the added weight, the added fat cells that cause the inflammation that's contributing to that fibrosis pathway, then we don't have to. But tirzepatide makes me feel so good. It has fixed my brain that I hope I never have to do without it. And I'm just on a teeny tiny microdose.
I love that. And we'll get to dive in more because it really does help us to understand this is a storm, a cytokine storm throughout our entire body that this is quieting. So I think there's this misconception of I have to be on it. So really it is a personal choice. I know I've cycled through it myself and been off it. And like you, I do feel better on it.
Yes.
And my ankle isn't ticked off and I feel better. So it is okay. Okay. So good.
Absolutely. So it's what it is, many times the inflammatory cytokines are localized.
Mhm.
Sometimes our markers don't even show up high.
Yeah.
However, it's like little compartments all their own, and it's a self-sustaining cycle. And that's why you can't lose it. And because of the fibrosis, and so I read research this past week that there's even calcium in there. Yeah. And so this is just I call it a toxic soup in there. Mm-hmm. And I'll show you my diagram in just a few minutes when we get to it to show you how tirzepatide actually calls all that out.
Amazing.
Yeah, it does.
We'll do that. So just two more quick myths to bust real quick. One of them is if I'm on a GLP-1, I can eat anything or not eat. I think we see women under eating too much because the dose is too high. So my point is, what is your direction with your patients, with your clients when they come to see you? What's the number one goal?
So the number one thing is I encourage them to eat at least 100 milligrams of protein a day. And the protein, we have to have the protein because number one, if you don't eat enough protein, it might make you lose a little bit of hair. Now, I know that's hard to do, but we also don't want to lose muscle because if we lose our muscle and as we're aging, that's hard to replace, and that's going to lead to falls. And I do make them sign. I have an educational paper that I make my patients read and sign. And the next thing I recommend as far as diet, I don't know if you're familiar with Barry Sears from the 90s. He wrote Enter the Zone. Okay, so this is my recommended, and I add a few little things. And but if you eat in this method, and I'll have to tell you why Barry Sears started studying heart disease, actually. He was only 47 and had more chemotherapy drug patents than anyone in the world at that time. That's how smart he is. And he decided he needed to start studying heart disease. And because all the men in his family actually passed away in their late 40s and early 50s. And so he started studying this. And what he found out was that the way we eat if we eat too many carbohydrates, we get that peak of insulin, and then it's the downstream inflammation. Okay. And if when we, so I added the order that we eat our food. Number one, eat your salad with olive oil first, because the olive oil, the fat, the good fats, no seed oils, actually goes to the duodenum and makes us secrete cholecystokinin, or CCK, and that starts the digestion of fat, but it also sends a message to our brain that we're full and the end of the meal is coming. So we've got that hormone going. So then if we eat our protein, the amount of protein is the amount that will fit in the palm of your hand. And that protein starts getting glucagon going instead of insulin. So the glucagon goes to the fat cells and says, come out, we need you for energy. We have no carbs on board. Okay. So we've got that good hormone going. Then the next thing, we can eat our favorable carbohydrates twice as much as the size of that protein. And then we go around to our unfavorable carb, which could be a small potato, bread, dessert, or pasta, but it's half that much. And if we eat in this order, he called it the zone because we're constantly tapped in to our main energy system, which is the fat cells. And whereas if we eat the carbs first, insulin, we're going to have that insulin peak. Insulin is a storage hormone. As soon as we eat those carbs, insulin comes out and piles everything. It comes out like an angry mob and says, get in that cell, get in that cell. And everything you eat past that carbohydrate is going to be stored as fat. Okay. Now, to give you one example, in ICU, when I worked in ICU, if we get a patient either in diabetic ketoacidosis with high blood sugar, or pancreatitis with a high triglyceride, we put them on an insulin drip, and it'll get a 3,000 triglyceride down to normal in less than 24 hours because it is shoving everything into the cell. That's what insulin does. So we have to control our insulin level and prevent insulin resistance. And that is insulin. That's what I push more than anything, because insulin is the most inflammatory thing, the most inflammatory chemical in our body. Huh. It is.
I had no idea.
It sets off that whole cascade. So what he found out, it's not what happens right when we eat that carb that causes that insulin peak. It's the downstream effect. It's like a domino effect of inflammatory cytokines again. And these are the hormones that actually cause disease, causes heart disease, causes strokes, causes diabetes, causes our blood to clot easier. Wow. And if we eat the protein glucagon way, that downstream effort are the hormones, eicosanoids, cytokines that prevent these diseases. So that is my favorite method to eat. And because he also, like me, is hacking hormones. Mm-hmm. So I read that book in the 90s. His dad, 2 uncles, and his grandfather had died from the age of 47 to 53. So I looked him up about a year ago, and I wondered, did he make it? Did this work?
Yeah.
And he was, at the time I looked him up, he's still alive at 77. So he is his own, he's his own, what's that word I'm looking for? Testimony. He's his own testimony.
Yes.
Plus, he's written 3 more books, and he's like the administrative founder of a national anti-inflammatory society or something. So, and you don't have to do without anything. If you want dessert, you can have it, but just eat in this order. Wow. Just eat in this order, and the plate palm method. I added the plate palm. He does it by ratios. And I think he went on to mention the plate palm. But if you do the plate palm and eat your protein first, eat the good fat first, then you're not going, you can eat anything you want, but you're not going to want to eat that much.
Mm-hmm. And that is so important to share,
Yes.
not only about the order that we're eating in, but it just solidifies, because everyone talks about protein first, protein. And every single woman on here knows that. We've heard it and pounded in our brains forever. But the minute it clicks and you start to feel better from eating that protein first, with my own story, it's incredible.
Yes. And when you understand why, you know, you've got that garlic bread if you go out to eat.
Yes.
And you know, if I start eating this garlic bread, which I love.
Yes.
And restaurants know what they're doing, by the way.
Yes.
And but you're going to, but not only you're going to be hungrier because that insulin peak is already shoving everything into the cell. So you're going to eat more for that entire meal. And so after, usually I see this a lot. They bring the bread, and after you've had time to eat a whole piece of that, then they bring the olive oil and all the mixture. And sometimes that happens. And so you're so hungry then that by the time you start eating your protein, you know, you're just going to eat, then you're going to order that dessert. You're going to
behind the eight ball.
Yes. Yeah. So if you know why, and I was always really tired after I ate, and that's what causes couch potatoes, because it's being pushed into the cell. There goes your energy.
Oh my goodness.
I first bought his book for that reason.
Amazing. Amazing. So one quick last myth, and then I really want to hear more of your explanation and why tirzepatide, why lipedema, why it's so helpful. But just when we talk about some of the negative side effects, and you touched on this briefly with hair loss, so we know we need to keep our protein up for hair loss and muscle loss. But, you know, I've heard some reports of depression and, you know, just the other negative side effects, and why do we hear so much negative noise, I guess, is the myth. There's so many negative myths around this injection, around GLP-1s, versus all the good that we see them doing.
Okay. I have actually, my patients have reported decreased depression on tirzepatide. I've only had one patient say that she got depressed on tirzepatide, and it causes, and I'm getting into my other stuff, it actually affects every one of our organ systems. Now, in the brain, it actually decreases neuroinflammation.
Huge.
Yes. And I did, and we talked about this earlier. I know I read more than what I was able to pull up about it affecting the dopamine. So dopamine, most of my patients have a genetic polymorphism called MTHFR. This can cause low dopamine. And because of the low dopamine, it can cause ADHD. It can cause narcolepsy. It can even cause autism. And it can cause anxiety. It can cause increased perception of stress. It increases our perception, because what this means so many times is a decrease in folate. And our body needs folate in order to form the neurotransmitters that make us happy.
Yes.
But and we fix that another route. But the tirzepatide actually does help ADHD and these other neurological symptoms with the low dopamine. And I did read one study, and I'm going to have to keep on searching, because one I read was that it does increase the dopamine in your brain. Now, I could not find that last night, and only by a small amount.
Okay.
But only by a small amount. But that dopamine reward pathway in the brain. Now, we know that with addicts, with alcoholics, and with drug addicts. So, excuse me. And I don't know why I'm so hoarse today. I'm so sorry.
You're okay.
So, the reason they're addicts is because of low dopamine. Mm-hmm. And so many people with the MTHFR, a lot of them that are addicts have found to be, have MTHFR. And the increasing the dopamine helps with this, but with that dopamine reward pathway, let's just say an addict that has low dopamine, and here's his pool. We only have so much of the dopamine and the substrates for that dopamine. So they go out and do their choice, drug of choice. Right. Their dopamine goes way up.
Yeah.
And then the next day, of course, it doesn't come back to baseline. It just goes so far down. And that's why they have to do it again. To own a smaller degree, and I'll be honest, the whole time I was growing up, I knew something was the matter with me. I felt like I was overweight. I had to go to extremes to ever lose weight. I mean, starving in my teens and 20s. And I had to exercise. My three sisters at that time were skinny. And I would be in there exercising in the family room, and Paula would come in there and be eating her pudding in front of me. And I was just different.
Yeah.
And but because of that, I had food noise. Mm-hmm. I was always obsessed with my food plan for the next week. It was like, okay, I'm going to start on Monday. I'm going to fast on Monday. I'm going to fast on Tuesday. I'm not going to eat anything until late on Wednesday. And sometimes I would actually do it. Mm-hmm. And then I would just allow myself a cracker. Isn't that terrible? I think I hate this for women because I feel like the stress I put on my body mm-hmm. is one thing that caused me to get breast cancer at 29. Mm-hmm. And so I think that tirzepatide is so good because of this. I was obsessed with food. I planned it. If I didn't make it through all day on Monday, it's like, okay, now I'm going to binge. I've blown it for this week. I'll start next Monday. Yes. And that's what I did constantly. Yes. My whole entire life was consumed. Tirzepatide, even this little micro dose, has stopped the food noise. Amen. And that is reported in many, many women. I'm not saying all women with lipedema have food noise, but because of my trying to lose weight all the time mm-hmm. and being conscious and exercising and having to work so much harder than my sisters, I was obsessed with it in my head. And I did end up with the binge, the
relationship. Yeah.
Yes, the bad relationship to food. At this point, I have a fantastic relationship with food. Mm-hmm. Most of the time, I shoot for 85 to 90% of the time. I do follow this, what I told you about the zone.
Yeah.
And but we can't be 100% of the time. Mm-hmm. Now today, I wanted a banana peanut butter sandwich.
Okay.
And yes. And I have not wanted one of those in ages. And so instead of getting out my protein, I fixed a toasted banana sandwich. Does that remind you of Elvis Presley?
It does. Yes. Yes.
So, but I ate it. I'm completely satisfied. Yes. I have no thoughts of, okay, I've blown it. Mm-hmm. And I don't even normally want to eat between meals. Mm-hmm. And then, but one thing I've noticed is that most of the time I do crave that protein and vegetables. Yes. It's like you want to say meat and potatoes because that's the backbone.
Sure.
But I do crave the protein. I do crave the vegetables that are good for us.
Yes.
And I've been actually cooking yellow curry lately and trying out different recipes. It's got all that in there. Plus, it's got the antioxidants in there with that curry that decrease the bad metabolites of estrogen.
My goodness, I could just listen to you teach us the whole this hours and hours and hours. So thank you for just addressing those, just some quick myths that we all hear and are so common to us. Food noise is always a big one. I think if we pulled lipedema women across the board, those of us that had a healthy relationship with food versus a poor relationship with food would be a very small number in that positive column. I mean, this is all of this history, all the years not knowing what we're dealing with, and the fight.
Yes.
You nailed it. I mean, you said it. We've always had to work 3 times as hard and limited results, if any. So
right, absolutely,
it has been very tough.
I think it actually controlled my life.
Yes,
because my focus was always on whether I was doing good or not, if I was doing bad. So whatever else I was doing, that was always hanging over my head. And it's not my fault. It's the fault of the dopamine.
Yes.
But this does fix me enough that I enjoy my life.
Yes.
I enjoy my food when I eat it.
Yes.
I never feel guilty because I really never want to overeat.
Yes. I mean, and that right there is what it's about. Enjoying our life, not having this hang up, not being controlled by our mind. This isn't a moral battle. This is a biological battle.
Absolutely. And my daughter Brandy, she developed lipedema in her early 30s. She was always tiny, tiny, tiny. And she found Dr. Hertz there in Tucson.
Yep.
And when she was diagnosed, so this was only about 9 years ago, we were already aware of the MTHFR, and that can cause this because of the estrogen breakdowns. And so when she saw Dr. Herbst and she told me, she says, well, I saw Dr. Herbst, I did get my diagnosis. And she said, I do have lipedema. And I said, oh, Brandy. And she said, well, you have it too? So that was my rude awakening. That's what was causing all of that from my knees up to my lower bottom all those years.
Yes.
And I had no idea. I had not known what it was.
Yeah. Brandy was so happy to share that with you.
She was my diagnosis. Yes.
Yeah. This isn't just for me, Mom. This is for you too.
Yes. Yes. Yeah. Now, Brandy started Lipedema Chats.
Yes.
And if y'all want to join that, she is out of that now, but there's so much information on there. And also Lipedema Strong Her. I'm an admin on both of those. Yes. And there's just so much to learn with those ladies, about their, whatever, there's so much information.
Yes.
No, Christy has the Strong Her, Lipedema Strong Her.
Yeah, we love Christy. She's an admin in my group too. So we love her.
Yes.
So you take us through. I know we've kind of talked about, I've got the outline of some of the things you wanted to talk about. We've talked about the inflammatory cytokines, but I know that you wanted to talk about how tirzepatide, yes, is a huge benefit for our lipedema, but like our organ system and some of the metabolic factors. And so I just want to turn it over to you. And then I know if we have time at the end, we've got a couple questions in the chat.
Sure.
So we'll be sure and hop in and get those as well.
Okay. All right. Well, I do want to say that the tirzepatide was the only thing that helped Brandy go backwards in her weight. And me both. I had on 30 pounds of night shift weight, and we had tried the semaglutide.
Okay.
But the tirzepatide is the only one that helps. And I think that it's so stronger at pulling out this inflammation. And
that was one of our questions, Carla, I'm sorry to interrupt you, but that's our first question was, In New Zealand, she's saying that tirzepatide isn't available. They don't have it. And she's asking if semaglutide would work. If you
Yeah.
had none, would you lean towards semaglutide, or what do you think?
I might try it if I had no other option.
Yeah.
But with all of my patients, some of them had tried, and friends, I have
Yes.
friends
Me
here in
too.
Scottsdale, but semaglutide has not helped any of them, and it makes people a little more nauseated,
Okay.
including me. Now,
Yep.
the side effects, I did have a tiny bit of nausea and GERD at first when I first started on the tirzepatide, but it passes quickly.
Yes.
And the GIP, tirzepatide is a dual agonist. It's the GLP and the GIP. And the GIP, it has a function that decreases the nausea.
Okay.
And so people tolerate it better. Plus, I don't have even one patient that has said that semaglutide helped them. I don't even prescribe it. I
Okay.
go straight to the tirzepatide.
Okay. Okay.
Okay.
And,
So
and again, I'm sorry to hijack you.
No,
You had that
all of it's
question in there, so I
good.
wanted to get that answered for her. So,
Yeah.
okay, back to you.
I'm going to show you something to start with. This, if you can see it, is a normal fat cell. And a normal fat cell is kind of like a little bubble of fat, just like you dropped oil in water.
Mhm.
It's a little bubble of fat. That's a normal fat cell, okay? And this normal fat cell has an anti-inflammatory environment, okay? It has adiponectin, and it also has IL-10. And those two are actually very anti-inflammatory, okay? Now I'm going to show you another fat cell, and this one is actually inflamed white adipose tissue. And I'm going to tell you how this is the mode. We always hear lipedema starts with stress, with hormonal changes, and synthetic hormone use. And I'm going to put this picture in your head, okay? This came from my advanced metabolic endocrinology class, and I wish Dr. Landa talked about, and this is why keeping our stress under control, babying it up here, saying, no, honey, you got this, calm. Okay. Stress makes testosterone aromatize into estrogen.
Okay.
When that happens, we have inflamed white adipose tissue. Do you see the difference in this cell?
Yes.
Okay. It's blown up.
Yes.
Okay. It's actually got a necrotic crown-like center. Some lipedema cells have this, but not that many. Okay. But this cell is very large. And in this cell and around it, it's got all of those inflammatory cytokines. Again, the inflammatory cascade is what starts everything, just like Barry Sears said. And I've been doing deep dives on this inflammation this past week. And but right here, we've got increased COX-2, okay? And underneath that, we've got PGE2 or prostaglandin E2. Prostaglandin E2, and these are the same cytokines that are present in lipedema. That increases our perception of pain. That is one reason lipedema is so painful. That's just one reason. The other reason is that our nerves are pushed up against a brick wall in there. But this is another reason. It's got all of these inflammatory cytokines. And that is all because of testosterone. Okay. So testosterone, there's an enzyme called aromatase. The aromatase turns our testosterone into estrogen. Estrogen is pro-inflammatory in this cell. Estrogen causes more aromatase.
Yep.
Aromatase causes more estrogen. And this is that self-sustaining cycle. Mm-hmm. And this is present in lipedema also. Okay. In this environment, we have, and these don't sound good, you don't have to remember them, but I'm just going to tell you. So this is what inflammation is inside that compartment syndrome of lipedema. Tumor necrosis alpha, IL-6, macrophage 1s, and it has decreased adiponectin. Remember that. Adiponectin is anti-inflammatory. Our adiponectin is gone. That is going to come into play in the last picture I'll show you. This is a picture. This is a diagram of GLP-1s all over the body.
Yep.
Okay. This came from my advanced metabolic endocrinology class. And this is the little packet that I give all of my patients, okay? So they will know exactly what it's doing. When we take tirzepatide in the brain, of course, it decreases our food intake. And guess what? If we're older and we're going through menopause and we don't have enough estradiol, estradiol pairs up with GLP-1s in our hypothalamus to decrease our appetite, to decrease and control our appetite, okay? It increases, these are huge, okay? Increases our learning and memory. Now, I know at my age, I'll take all of that I can get. And when I haven't had my dose, I did without it for a couple of weeks, and I lost my words more often. Yeah. So it is neuroprotective. Yes. It actually, because it decreases neuroinflammation, it is even helping people with Parkinson's and Alzheimer's disease.
Yeah.
Okay.
Amazing.
And with that reward behavior, the dopamine reward cycle, okay? What it does, say I do have an eating disorder and I'm eating a lot and just because I love it and it makes me feel good. I've got that little piece of cheesecake. That's my favorite. And oh gosh, it made me feel good. I'm going to have a little bit more. I'm going to have a little bit more. That's dopamine. And I used to do that. Okay.
Oh, me too. Yep.
I can eat a little piece of whatever I want. This is where tirzepatide comes in. It stops the reward feeling. It stops that reward feeling. So whether you're a drug addict, alcoholic, or a food addict, you can eat that for satisfaction, but you're not getting that dopamine. It prevents that dopamine high. So you lose the desire to eat that way. Okay. It decreases apoptosis of the brain cells. Okay. On to the liver. It decreases gluconeogenesis. And what that is, of course, is blood sugar peaks. Just say all of a sudden you're stressed, your cortisol comes out. The cortisol is going to try to save your life, and it causes gluconeogenesis from your liver.
Okay.
And that's going to make your insulin peak because that's what insulin does. And then it's inflammation downstream, okay? It stops that. Okay, steatosis. What this is fatty liver. Fatty liver disease. Non-alcoholic fatty liver disease is higher right now than it's ever been. Guess what? this decreases. I've got 2 patients that have it, and this decreases the amount of fatty stored in fatty liver disease. Okay. All right. In the GI tract, we know it slows gastric emptying and motility. Okay. I'm going to grab a sip real quick.
Yes, ma'am.
I might should have got a cough drop. I didn't realize till I started talking to you how hoarse I suddenly had gotten. And this is the big, huge thing to me, because I was always an ICU nurse, CVICU nurse with fresh open heart patients. And I know how the heart works frontwards and backwards. Okay. And still, I am associated with a lot of congestive heart failure patients. And I'll just tell you right here, I think it's Januvia, okay? Januvia is also an anti-diabetic medication. And a few years ago, they approved that for congestive heart failure, okay? Anti-diabetic, and they approved it for congestive heart failure patients, okay? So back in my day, when we wanted to lose weight, the only medicines that were prescribed were amphetamines, or that whatever that other one was that ended up causing heart disease. And so this one, going through this list, and I don't want to overshoot we've got 15 more minutes. It increases the contractility of the heart. That's what congestive heart failure patients have lost. It's called the ejection fraction. And the ejection fraction of the heart is supposed to be like 60 to 70%. Like when that heart pumps and gets the blood out to first your heart, then your brain. And people with congestive heart failure have lost some of their contractility. Okay. This increases the contractility of the heart. What does that? So therefore, it increases cardiac output. Okay. It increases myocyte, the cardiac cell survival. It increases cardioprotection. It increases glucose utilization by the heart. It increases vasodilation, which therefore it is a natural antihypertensive. It increases glucose uptake, and the top one, our left ventricle in our heart, there's 4 chambers in our heart. The left ventricle is the one that works the most, because that's what I just tell you. It increases left ventricular function in the heart to pump that blood to our heart, to our brain, and to the rest of our body. What's that going to do? It's going to give you energy. You're getting oxygen all over your body, not just to your heart, not just your brain, but all your muscle cells for energy. It increases bone formation. It increases bone mass. It increases the insulin sensitivity in the cells, in the muscle cells, and increases glucose uptake. So what does this mean? That right there decreases inflammation because it reduces insulin resistance. Isn't that great? What else does this? Okay. In the kidneys. And this where it's important for congestive heart failure patients also. In the kidney, it increases diuresis. That means we're going to put out more urine. We're not going to have so much swelling, so much edema. Okay. All right. In the pancreas, and this is huge. Every time I get to one of these, I say, this is huge. So what does that mean? Okay. The pancreas increases insulin secretion. It increases. Yes, it does. But in this other processes, it's not going to need as much. Okay, so that's going to go down. It increases insulin synthesis. It decreases glucagon secretion. It increases beta cell proliferation. And that's great because a lot of type 2 diabetics don't have those beta cells working as much anymore. And they're not putting out as much insulin. Okay. Betas, no, that's actually LADA. Latent, adult onset, latent, adult onset diabetes. Okay. That will help that. It increases beta cell survival. Okay. So that we just went around the body practically head to toe. Now, what part of the body did it not help? And now this is the clincher. Remember from the first page, I told you to remember adiponectin. Mm-hmm. Adiponectin is an anti-inflammatory hormone in our body. Guess what tirzepatide does?
Increases it.
It increases adiponectin. So, yes, so I've been talking to y'all about the inflammatory cytokines ever since we started.
Yes.
Adiponectin goes all over the body. It's targeting the oxidative stress. Mm-hmm. It causes, it protects the pancreas from all these cytokines. It protects the liver. It's taken down all of these inflammatory cytokines, tumor necrosis alpha, IL-6, etc. It is in the skeletal muscle. It increases fatty acid and glucose use and decreases the lipid content. It decreases all inflammatory cytokines.
Wow.
And that right there is what causes fibrosis. So this week I've been doing a deep dive on the cascade. And I believe I've told you before that 16-hydroxy metabolite can cause fibrosis all over the body. So that is really it. The way it does that is because of the inflammation. It directly sits on the receptor sites. Mm-hmm. The ERA receptor sites, that causes inflammation. These inflammatory cytokines come out, and there is one growth factor that comes out in particular that sets off another chemical that right there at the cellular level causes fibrosis. I won't get into all those names, but any inflammation in our body does this. We have to keep our hormones balanced and detoxed. Yep. And all of my patients that have that high 16-hydroxy and have lipedema, and that then, or either they did when they were younger, now they're older and they don't have that much estrogen to detox. But this inflammatory, even the inflammatory markers, like I'm sure you're familiar with C-reactive protein. Mm-hmm. Okay. That's not just a marker of inflammation. It also causes inflammation. We have two C-reactive proteins. We have the high sensitivity and the quantitative. And one of them is more specific to the heart. One of them is like the entire body. But both of those cause inflammation. They're homocysteine in our blood. That can build up because of the MTHFR and not enough methylation and detox. And therefore, what homocysteine does, it causes inflammation and fibrosis itself.
Wow.
It can cause breast cancer. It can cause fibroids. It can cause the fibrosis of lipedema. So these inflammatory markers, every one of them downstream somewhere can cause fibrosis.
Mm-hmm.
So this is huge. And I know all of this is just for educational purposes only. You do say that at the first of yours, right?
Yes, I'm glad that you're putting that in there, but yes, I will put that when I post it for sure.
Yeah,
Yes.
yeah. And so all of these, the best thing we can do for ourselves is to baby our circadian rhythm, because the circadian rhythm is number one, not to have inflammation. That cortisol curve high in the morning and slanting down in the afternoon and flat at night, then melatonin at night. Melatonin is and glutathione are our two only native antioxidants of our entire body that have been there ever since the beginning, you know. And if we baby our circadian rhythm and we have that melatonin come out at night and support our glutathione, that's our native antioxidants. And otherwise, of course, there are other antioxidants, and based on how my patient's labs come out, I decide on what plan I'm going to have for her.
Yes.
Never two the same.
Right. Right.
Okay. Did that make sense?
Oh my gosh. Good news, more good news for our liver, good news for our heart, good news for our brain. Yes, I mean, it really is when we dive in and can get past the noise that we see so much
Yes.
surrounding these peptides and specifically tirzepatide. It blows me away. I mean, it genuinely blows me away to get to learn from you and hear all of the things that these peptides are doing.
Oh gosh, I probably drive my people that are around me, I probably drive them crazy. But this is super good. And you know, there are side effects that they have that we have to tell our patients. And one of them is the slow motility, you know. And that happens. The side effects, I've never had a patient have these side effects. And there's one visual thing, and it is optic nerve infarcts, but it's like so low, and it's all with the high doses.
Right.
You know, and I don't even have one single patient that has gone to the upper level. And, you know, the pharmaceutical companies, what they do is back in the day, they would start you off at 2.5 for a month. Then you had to get the next pen, 5 for a month, 7.5 for a month, and then 10, you know, and it was no option to microdose.
Right.
But microdosing, I think I do 1.5 to 2 milligrams. And I don't have a single patient that's gone up to the top level. And it's no issue if you do, because those things that have happened that we have to tell patients are very rare. They are very rare, and they are with the maximum doses. And if someone needs to be on the maximum dose just to get out of that cycle, like this cycle that I showed you, this is self-sustaining. It's like that little cell right there does not need anything else. It doesn't need nutrition. It's making estrogen, aromatase, more estrogen. There's also another axis called the insulin. It's the insulin axis, and it's something kind of just like that when people do have insulin resistance and high insulin levels. So to get out of that cycle, we gotta try something new. You know, what we've tried is not working. We've got to try something new. And people might just have to be on that highest dose for a little while, then scale back down. Because as long as you're breaking into these cytokine compartments and you're pulling that out of there, and you're breaking a cycle.
Yes.
But I feel so sorry, and I empathize with people because they do try everything they know, and they're at their, you know, it's such a sad thing.
It is.
But we can get out of that cycle. We can break it, and you know, I'm just really thankful that we can.
It's incredible to learn that we do have tools, that there are ways to break through these cycles, because as you've mentioned throughout this conversation, is there is also the mental impact that is triggering inflammation. So if I'm trying and I'm in this cycle and I can't break out and I'm doing all the things, that's not helping my mental health either. So, I mean, it really, obviously our body all works together.
Yes.
Mentally, physically, there's so many pieces to
this. That's the same as the stress.
Yes.
And just say, I'm sitting here and thinking that I am so upset because I've tried everything I know. And that's making me, and our body doesn't know if we're stressed from thinking about something like that, or we're running from a tiger. It's going to start that process that leads to inflammation.
I say that sentence to my daughter daily.
Got
to talk to our brain.
Positively. Right. We have to talk to our brain.
Yes.
Do we have any? Oh, well, another thing tirzepatide does that is not on there, it itself breaks down fibrosis.
Oh.
Yes. Okay. And I'm going to look that up because there was an article out of about a year ago, I guess. And this, what he was saying was, what his theory was, that if tirzepatide is known to break down the fibrosis in the heart.
Wow.
It's known to break down the fibrosis in cystic fibrosis. Okay. So he presented all that information, and his theory was that if it can break down that, why would it not be the same pathway and to break down lipedema? And I saw an article lately that said it does, but what I've pulled up just now, it says it does not directly, but it does reduce the fibrotic processes by lowering fibrosis driven pathways. And that's part of the big words that I didn't scare y'all to pieces with, but just know it interrupts all of those pathways.
So even if we don't have the proof today that it's breaking down fibrosis, it's interrupting the pathway that's causing more fibrosis.
Yes.
Yeah.
It is. Yeah.
Awesome. Well, if you don't mind, if hanging out for a couple minutes and we can these FAQs, but I'm going to stop the recording for our ladies that weren't able to come. They don't get the FAQ. Sorry, ladies. Okay. But just thank you so much, Carla.
You're welcome. My pleasure.
I'm just going to stop this recording real quick.
Okay.